Hi, everyone. I had just turned on the recording mechanism, so for those of you who have to leave early or who jump on late, you'll be able to access this recording in a few days. I will send it over to your coaches. All right, today we're going to talk about gingivitis and how to incorporate perioprotect trays for these patients. Remember, we still need to treat at the office level our patients however we're treating them, right? Do your 43, 46, do your irrigation, whatever your protocol is. But perioprotect trays, they're about their home care, right? We know that patients have a hard time with home care. Otherwise, they wouldn't be in this position that they're in right now. So, these are a couple photographs of gingivitis. We see it, we treat it, then we send them home. They've got to have something at home to help them with their home care. Um, Brushing, flossing doesn't always get there. So, what are we going to use for them? And remember, this has to be on a daily basis. So, gingivitis is an inflammatory response to bacteria that it has been sitting in their mouth, right? It hasn't gone away. They can't get it off. Sometimes there's calculus there, sometimes there's not, but it is reversible. So, but we got to treat it, right? And then we have to follow up. You cannot have radiographic bone loss to call a 43, 46 or attachment loss. Um, but do use the code, treat what you have diagnosed. What do we see? We see inflamed gingiva, shinier, smooth gingiva, increased bleeding, whether it's spontaneous or delayed, sensitivity to hot and cold. Patients will complain about that. Bad breath and tenderness upon chewing. Risk factors. Tons of risk factors here. Hormonal changes, right? A lot of times we see this with pregnancy. Poor oral hygiene, diabetes, family history of Perio disease, xerostomia, medications, and just overall poor habits. So what do we do chair side? Scale, laser, irrigation with antimicrobial. But again, this is all chair side. So what do we do at home for them? We have to improve that home care. So brushing, yes, hugely important. I would suggest electric toothbrush for these patients. Flossing's great, but how many of our patients truly floss, right? Not a lot. I do believe they say like 7%, even though a lot of them will say, oh, yeah, I'm going to brush. Water pick is great. Patients complain it's messy, and are they going to do it? Again, we have to make home care easy. Antimicrobial mouthwashes to go home with patients. Great. But again, are they using it, and are they using it every day? And does it really get to the base of that pocket? So Perio Protect trays, super easy to use. And even for your patients who don't have the dexterity, they feel they don't have time, Perio Protect trays are very easy to work into their daily routine. We also have to make sure that prevention-wise, that we're seeing these patients on a frequent preventive visit, right? We can't just say, oh, you're done. Here you go. Here are your protect trays. You need to see them back in the office. So how do we add this to our gingivitis therapy? First and foremost, we have to make sure that we are periodonting every adult patient every time they sit in the chair. We need pocket depths, we need bleeding, you need everything on there. You need radiographs. And remember, no radiographic bone loss or attachment loss for your D43, 46. And typically 30% or more of the mouth with moderate inflammation and or bleeding is considered your 43, 46. Look at that health history and the familial history of their oral issues in their family. Remember, scale, irrigate, home care instructions are huge. Perio Protect trays are your long-term home care solution, right? We can reverse this. They don't have to move on to periodontal disease with bone loss. we need to get these patients early, right? Because we know we can keep them free from bone loss if we get them on trays every day. So to get your trays going, what do we need to do? We need to do their therapy chairside. We need to scan the patient. We need to send it to the lab. Delivery appointment 7 to 10 days after submission to the lab. Delivery appointment takes about 15 minutes. We have a delivery appointment video that I have sent over to the coaches. You can put that in your operatories, loop it right in and show them the video. It just reinforces what you're telling them chairside, and have them register their trays. If they register their trays, they're going to get emails, they're going to get more information on use. It's just, it carries through our message, right, from the office. So this is what it all looks like when you get it back from the lab. You have your trays, that you have the case to put the trays in. You have the tube squeeze. You have the home care instructions, because no matter how many times we tell them to do things chairside, they forget. So those home care guide are the simple instructions on how to use the trays. And then it comes with this great bag and with some tissue paper. So that's a great thing. On the bottom of this case is a QR code. That QR code you can scan, and it takes them right to the resource center, which again shows them the videos, how to use it. Actually prompts them to take a picture of their mouth today, the first day that they have them. And then it will prompt them a few weeks later to take another photo of their mouth so that they can compare. And it will send them emails on a 3, 6, 9, 12-month basis to encourage where to call your dentist for your recare appointment. So it actually brings them back to your office. Now, how do we use this? So when we're talking to the patient, we want to work it into their daily routine. You want to get that commitment from the patient. And I always say, work it into something that they do every day. Do they walk their dog? Do they work out? The easiest way to work it into their daily routine is your morning routine, right? You get up, you jump in the shower, but before you jump in the shower, pop in your trays, right? So you're going to shower, you're going to shave, you're going to do your makeup, whatever. That all is going to at least be 15 minutes, at least in my world, right? So I think it's a great way to get them to start. They have to wear those trays for 10 minutes to get the initial kill, 15 minutes for full oxygenating benefits deep down in the pocket. Brush their teeth after use. If you wear the trays before brushing, it increases the effectiveness of your brushing, because it's beginning to break down those protein change and that slime layer of the bacteria that is in their mouth. After they have had the trays in the mouth for 10 to 15 minutes, they take them out of their mouth, they brush the trays with cold water, and they sit in their case to dry. Make sure the case is up on a counter away from where dogs can reach, because we know how dogs love oral care deals that are in the mouth, whether it be trays, retainers, mouth guards. They love these too, right? Because they're nice and stinky, even though you should have had the hydrogen peroxide in. It does help. They still like to chew on these things. So keep them up away from animals. No hot water. I don't know why it says hot cars, but hot oil or oil-based products. Oil-based products break down the trays. And just trays should last 5 to 10 years if they're taken care of. Oh, no hot cars. Don't leave the trays in hot cars. That's why that's on there, because it will warp the trays. So just like it will, they tell you not to do the same with retainers, things like that. So a hot environment, we don't want to keep these trays in. And to order the gel, they can go to periogel.net. There is a coupon code, and the code is MyGel, and that gets them a one-time discount on gel. This is what the gel looks like. You may either have the Perio Gel X or the regular Perio gel. The Gel X just has xylitol in it, and it's not as minty as the regular Perio gel. But when you start with trays, you're going to want to use them twice a day for 3 weeks, and a tube will last 3 weeks. So that first tube will last 3 weeks, and then you'll have the other 2 tubes, which last 6 weeks. So if you have someone on perio maintenance, you're going to need 3 tubes of gel. If you have someone on a 6-month recare, you're going to need about 6 tubes of gel for them before you see them. Okay, additional benefits. Yep, it whitens teeth within 4 to 6 weeks. It's not going to be overnight. It's going to be in 4 to 6 weeks. And also fresher breath. The fresher breath, they're going to see within the first week of use. So that is a great thing, especially if they have morning breath. They get very excited about this. And just a little piece of information for all of you. If you have done gingivitis therapy or SRP, you can then, they can use their FSA or HSA, but they have to be prior diagnosed with 43, 46 or perioscaling. Okay, are there any questions? This is my number and my email. If you all ever have any questions, I'm here for you and Strain to help you with anything. But if you have any questions, now's your time. You can either put it in the chat or you can come off mute and ask your questions. Okay, I'm not seeing.
Yeah, I'm all good.
Okay, all right. Well, you have a great day. Thanks for
Thank you,
jumping
Janice.
on.
Yes, thank you.
All right, bye.
Bye-bye.